back with Why Wednesday. We're going to talk about headaches this week. This is our preceptor for those of you who've been in here. This is soon to be Dr. Ryan Hartley. He's going to help me out with this. We're going to explain what we can do for headaches for you, how we assess for different types of headaches, and then some things that you can do to hopefully help you with headaches. And we know that there's all different types of headaches. We have cervicogenic, we have tension, which are mostly the same thing. And then we have migraines with and without aura. And then there's some other strange underlying pathology-driven headaches that we're not going to discuss now. I will post a really good article tomorrow that you guys can read and go through the different types of headaches. For migraines, that's the one unknown headache out there. There's a lot of research, but still people don't necessarily know the exact mechanism behind migraine headaches. But what is important with a migraine headache is if you do get those and they're true migraines where you're light sensitive, sometimes there's a change in smell, sometimes there's other like sparkly light things, some visual changes with those, that you do get that worked up and kind of figure out what's driving that. And there's some really good resources as far as triggers that are out there. Some of it can be triggered by caffeine, by chocolate, by different foods, by allergies. And so I would encourage you to get that worked up. And I also have a link to that diary that you can look at to see if there is some sort of a external trigger that's causing the migraine headaches. But again, even the brightest minds don't necessarily know what drives migraine headaches, whether it's too much constriction in the vessels in the head, or if they open too quickly, or if it's a change in blood pressure or a change in chemistry. There's a lot of different variables to migraine headaches. Hormonal changes is another big one. So some of that needs to be worked up further in a functional medicine type setting to really understand what's going on with migraine headaches. But we can help with them, and we have in the past, because if there is a musculoskeletal component to it, then that's kind of what we do here, is to help with the muscles and the joints that are involved in those kinds of things. So tension and cervicogenic headaches, some research would suggest 15 to 20% of people worldwide will experience some sort of cervicogenic headache. And that's what we're going to talk about here. Typically, and I put that picture there, typically the cervicogenic headache, tension headache, is going to be wrapped around the temples bilaterally. Sometimes it's going to set up behind the eye, or it's going to radiate around from the back of the head into a ram's horn distribution. Sometimes you can get some feelings of like a fullness of the ear. You can get dizziness. Sometimes you can even get like mouth pain because of the referral. We do know that cervicogenic headaches and tension type headaches do have a musculoskeletal component that involves the little muscles in the back of the skull here. So there's there's actually four muscles that make up the suboccipital group, and they act and they lay in a kind of a triangle type pattern here in the back, really close to the vertebral artery. And there's also different types of nerves. There's the suboccipital nerve, the trigeminal nerve, facial nerve. All of these things run around this area. And so if there's held tension in those muscles, then it can affect the neural patterns around there and give you really strange referral patterns. Sometimes right behind the head, like I said, behind the eye is a common one. Wrapping around the ear and into the ear is another one. They call that the ram's horn distribution. And then the bilateral around the temples, like a band, somebody is squeezing a band around your head. That's another pattern that can come from these muscles. So from a treatment standpoint, I'm going to walk you through what we would do for that. It's relatively simple for those of you that have been in here, that they kind of know what this is about. We always start with the muscle work. So I'm going to have Dr. Hartley lay on his back here. And from a treatment standpoint, we want to release the muscle system first. So what we'll typically do with this is just a light stretch. We call this a PIR in the manual therapy world, where all he's going to do is he's going to breathe in and look up towards the ceiling. He's going to breathe out, look down, and I'm just going to let gravity take his head straight down towards the floor. So his chin's going to come into his throat as we do this, and we're going to do 5 or 6 rounds of this where we just slowly release the muscles. This is the suboccipital muscle group that causes headaches. And so we would have assessed this. We would have gone through our vertebral artery insufficiency tests already, which is where we basically look for compromise of that upper cervical spine area. We would have palpated this. We would have known if there's hypermobilities or hypomobilities, meaning the cervical spine moves too much or doesn't move enough. If it moves too much, then we can still do the muscle work. We just won't do the adjustment that I'm going to show you here at the end, because we don't do adjustments in areas that move too much. That's not indicated, and is also some of the reason that you could have some of the things that you hear about in the upper cervical spine. So we don't do, we would run you through those assessments, and if it shows that there's any sort of insufficiency or hypermobility, then we wouldn't do the adjusting part of this. But I have already palpated Ryan. I know that he's got a little restriction, so we're going to show you what we would do from an adjustment standpoint. We could also do some myofascial release, where we actually go through and release the adhesions. We do know from research that there are some dural adhesions in this area caused by the tension in the suboccipital group, and that was talked about in that video that I posted yesterday, where we do know that there's adhesions around the spinal cord and around these areas, these nerves in the upper part of your neck, that can lead to these referral patterns that cause cervicogenic or tension type headaches. And so this would be the technique that we could use to release some of those things, where we use a little bit of compression and release the adhesions around that area, depending on the side that we find that's most involved and just the feel of it. So again, there's a palpation aspect to this, so we would have to do that during our assessment. We could also do some dry needle to this area, so we could actually take needles and put into this area, which will help kind of release the trigger points, which would cause some of these referral patterns into the eye, ear, and head. And so that's another option. So we have light stretching, more aggressive type muscle release work, and then we can also do dry needle. We can kind of go in that order. After that, we would do some sort of an adjustment to get the upper cervical spine to free up. If they're holding tension in these little tiny muscles in the back of the head, they're compressing the top part of the skull and the next two vertebrae, because that's where they attach. They attach into the occiput, which is the skull. They attach into C1, which is the next vertebra down, and they attach into C2. So it's compressing all of those structures together, and then you lose motion. And if you lose motion, then your brain starts to think that that area is under some sort of threat, and so it continues to increase the tension in these little suboccipital muscles, which adds to more compression, which can lead to more sustained headaches, and then you get into a chronic loop where you just continue to compress and tense these muscles, which leads to more and more headaches. And so if you don't do the joint work, if it's indicated, then you're only getting part of the problem. And so we would also adjust this. We could do it here, where we just laterally bend a little bit, add an impulse, and then we can free up the upper cervical spine. It's really that non-scary. We can do other things. If you don't like your upper cervical spine messed with, or you don't like to be adjusted, then there's other options. We have a little board in here that I could actually free this up. I can put the board underneath Ryan's head and do a little drop, which will also open up those joints without the cracking and the popping. But we do have to do something to get those joints moving. Otherwise, if we just free the muscles up, it's not enough to free up the joint restrictions that were caused by the muscle tension to begin with. And so you can sit up. So those are some of the things that we can do for headaches. Some of the things that you can do are stretches, where you would look down and away from the side and do a little chin tuck. That would actually open up that space in the back. Or you can even do chin retractions with a little bit of counter pressure while you do the chin retraction. That will also open those up. Typically with headaches, it has a side, so you would like to look away from the side that's involved, so look away from the pain, do a chin tuck, that opens up that little space. That's a stretch that you could possibly do at work. The other things that you need to consider with headaches is a nutritional or an inflammatory type of response that's going on that's causing the headaches, that can also increase the frequency and the rate and severity of the headache. And so almost all headaches have some sort of magnesium deficiency. So you want to look at some magnesium supplementation with that. and it's not the citrate, because the magnesium citrate is kind of like a laxative, but you want to look at magnesium oxide specifically as a supplement. And there's, depending on the dose or the concentrations of the magnesium oxide, would kind of depend on how many you would take, the dosage of that. Another herb that's really good for headaches is feverfew, and you can find these pretty much in any health food store. Your Whole Foods type, natural grocers type of stores will have these. And then vitamin D3 and fish oil are two other really important supplements. But if you only had to pick two, which you don't have to because most people can, these are relatively inexpensive supplements. Magnesium is a must, and so is the feverfew. Like, those two things can really help you. And then if you could do some sort of food diary to see if there's other triggers like chocolate, caffeine, even some sugars can trigger headaches, then you can start to do some elimination work to see if that's also a trigger. So just briefly, there's lots of different types of headaches. If you have questions about that, then feel free to call here, shoot us an email. I'll try to answer as many questions as possible. But for the time being, if you're struggling with headaches, try the stretches, try the supplementation. If that doesn't work, then feel free to give us a call, shoot us an email. We'll try to help you as much as possible. So we'll do this again next week. We'll have another Why Wednesday topic, and we'll lay that out for you on Monday. Thank you.